A woman's reproductive system includes the vagina, cervix, uterus, fallopian tubes, and ovaries. During vaginal sex between a man and a woman, semen passes out of the man's penis into the woman's vagina in a process called ejaculation. Semen contains tens of millions of sperm. From the vagina, sperm can pass through the cervix, uterus, and fallopian tubes to fertilize an egg from the woman's body. Fertilization of the egg marks the beginning of human development. A birth control sponge is a temporary method for women to prevent pregnancy, also known as birth control or contraception. The sponge is made of soft foam. It has a dimple on one side and a short cotton loop attached. The sponge prevents pregnancy in two ways. First, the sponge covers the woman's cervix to prevent sperm in the man's semen from entering her uterus. Second, the sponge contains a substance called spermicide that kills sperm. Birth control sponges are widely available without a prescription. To use a sponge, wash your hands and remove it from its package. Wet the sponge completely with clean water. Squeeze the wet sponge a few times to activate the spermicide inside the sponge. Next, hold the sponge with the dimple side facing up and fold the sponge upward. With the loop hanging down, insert the folded sponge into the vagina. Push the sponge as far into the vagina as it will go with 1 or 2 fingers. When the sponge is released, it will unfold and cover the cervix. Check with your fingers to make sure the cervix is completely covered by the sponge and the loop hangs down in the vagina. A woman can have sex right away or up to 24 hours after inserting the sponge. Do not leave the sponge in place for more than 30 hours. To remove it, insert a finger into the vagina to find the sponge's loop. Poke a finger in the loop and pull down slowly and gently. After removing the sponge, throw it in the trash. A birth control sponge is about 90% effective at preventing pregnancy if a woman uses the sponge correctly every time she has sex. This means about 10 out of 100 women will become pregnant each year. Sponges are about 85% effective with typical use, which means about 15 out of 100 women will become pregnant if they don't always use a sponge or don't always use it correctly every time they have sex. Using the sponge does not protect either sexual partner from getting sexually transmitted diseases, including HIV. He worked with Anglo-Saxon bankers to develop a measure of sexual transmission of the virus. What is the vaginal sponge? The vaginal sponge is a soft, disc-shaped device made of polyurethane foam, often about 2 inches in diameter. It contains a spermicide, non-hormonal 9, which is an ingredient designed to kill sperm and prevent fertilization. The sponge is inserted deep into the vagina before sexual intercourse to act as a barrier and a spermicide. Its design is simple but effective. It fits snugly over the cervix, creating a physical barrier to prevent sperm from entering the uterus, while simultaneously releasing spermicide to further reduce the likelihood of pregnancy. The vaginal sponge is typically available over the counter and does not require a prescription, which makes it relatively easy to obtain and use compared to some other methods of contraception. How does it work? The vaginal sponge works through a dual mechanism of action. Physical barrier. Once inserted, the sponge sits over the cervix, physically blocking sperm from entering the uterus. It creates a mechanical barrier that limits sperm from passing through the cervix and reaching the egg. where fertilization could occur. Spermicide action. The sponge also contains spermicide, usually non-hormonal 9, which kills sperm before they can enter the cervix. The spermicide spreads throughout the vagina when the sponge is moistened, creating an inhospitable environment for sperm. By combining these two actions, blocking and killing sperm, the vaginal sponge can significantly reduce the chance of pregnancy during unprotected intercourse. However, it does not provide protection against sexually transmitted infections, STIs, which is an important consideration. Effectiveness of the vaginal sponge. When used correctly, the vaginal sponge can be an effective contraceptive method, but its effectiveness varies depending on factors such as the number of sexual acts and whether it's used properly. With perfect use, the vaginal sponge can be about 91% effective in preventing pregnancy. Perfect use refers to consistently using the sponge in the right manner each time it's needed. Addities. This includes a huge range of senses, such as camera triggers, number inning, plight sight, camouflage, promotion time, self, signs of presence, contact with nature, and variation in because typical use involves human error, such as improper insertion, forgetting to use it, or not leaving it in for the recommended duration after sex. The sponge's effectiveness also depends on whether the user has ever given birth. For women who have not had a baby, the sponge tends to be more effective, with a higher success rate, compared to women who have given birth, where its effectiveness is lower. Ease of use. One of the major benefits of the vaginal sponge is how easy it is to use. There are no complicated procedures or daily routines to follow like with birth control pills. The sponge is designed to be inserted into the vagina prior to sexual intercourse, and it can be placed up to 24 hours before sexual activity. Here are the basic steps for using the vaginal sponge. Insertion. Moisten the sponge with water to activate the spermicide, then fold the sponge and insert it deep into the vagina, making sure it covers the cervix. It should be placed about 1-2 inches inside. Timing. The sponge can be inserted hours before intercourse. However, it needs to stay in place for at least 6 hours after sex to ensure its effectiveness. Removal. After intercourse, the sponge should be left in place for 6 hours and then removed. It should not be left in longer than 24 hours to avoid potential risks such as vaginal irritation or infection. How long does it last? Each vaginal sponge is designed to be used for a single act of intercourse. After it has been used, it must be removed and cannot be reused. The sponge is effective for up to 24 hours, but it should not be left in for longer than 6 hours after intercourse to ensure safety and prevent irritation. While you can use one sponge for multiple sexual encounters within a 24-hour period, you must remove and dispose of it after use. For each new sexual encounter, a new sponge will need to be used. Pros of the vaginal sponge. There are several advantages to using the vaginal sponge as a contraceptive option. Non-hormonal. Unlike many other contraceptive methods, such as birth control pills, the vaginal sponge does not contain hormones. This can make it a good option for women who cannot or prefer not to use hormonal birth control methods. No prescription needed. The vaginal sponge is available over the counter, which makes it accessible without a doctor's visit or prescription. This can be especially convenient for women who want a quick and easy option. Convenience. The vaginal sponge can be inserted hours before intercourse, offering flexibility. It doesn't require any ongoing attention, as it remains in place for up to 24 hours. Discreet. Because it is inserted internally and doesn't require external devices like condoms, it is discreet and doesn't interfere with the sexual experience. Cons of the vaginal sponge. While the vaginal sponge offers several benefits, there are also drawbacks to consider. No STI protection. The vaginal sponge does not protect against sexually transmitted infections. For this reason, it's often recommended to combine the sponge with condoms if STI prevention is a concern. Possible discomfort. Some women may find the sponge uncomfortable to insert or remove. It can also cause vaginal irritation or allergic reactions in some individuals. Not suitable for all women. The vaginal sponge may not be the best option for women with certain health conditions, such as vaginal infections or an increased risk of urinary tract infections, UTIs. Higher failure rate in women who have given birth. The sponge is less effective in women who have given birth, as their cervix may be more open, allowing sperm to pass through more easily. This can result in a higher pregnancy rate for these women. Insertion and removal. The insertion of the vaginal sponge is straightforward, but requires some attention to detail. Insertion. The sponge should be moistened with water before insertion to activate the spermicide. You'll need to fold the sponge and insert it as deeply into the vagina as possible, ensuring that it covers the cervix. Removal. After 6 hours, the sponge should be removed. To remove the sponge, you can hook your fingers around the removal strap or cord attached to the sponge and gently pull it out. It may require a little patience and care to ensure it is removed without discomfort. You should use it. The vaginal sponge can be a great option for women looking for non-hormonal contraception or those who are unable to use hormonal methods due to medical reasons. It's especially useful for women who prefer on-demand contraception, women who don't need a daily or long-term commitment. However, it may not be ideal for women who experience frequent vaginal infections or have sensitivities to spermicide, as this can lead to irritation. Women who are prone to urinary tract infections, UTIs, may also want to consider other options, as the sponge may increase the risk of UTIs in some cases. Considerations and alternatives. Before deciding if the vaginal sponge is the right choice, it's important to consider other contraceptive methods. IUDs and implants. For long-term contraception, IUDs or implants are more effective and require less effort. These methods do not rely on user action every time you engage in sexual activity. Condoms. Condoms are another non-hormonal contraceptive method that also offer red-based contraception. For those who want both contraception and STI prevention, using a condom alongside the vaginal sponge is a good option. Consulting with a healthcare provider. If you're unsure which contraceptive method is best for you, it's always a good idea to speak with a healthcare provider. They can provide guidance based on your medical history, lifestyle, and preferences. In conclusion, the vaginal sponge is a simple, non-hormonal contraceptive option that can be effective when used correctly. However, it's essential to understand both the benefits and limitations of this method. While it is an accessible option for many women, it's important to choose a contraceptive method that best suits your health, lifestyle, and preferences. By exploring all available contraceptive options and consulting a healthcare provider, you can make the best choice for your reproductive health. Thank you.